Keystone Quality Transport, HIPAA, Privacy and Security Training. HIPAA stands for the Health Insurance Portability and Accountability Act. HIPAA was signed into law in August 1996. This federal law was primarily to modernize the flow of healthcare information, stipulate how personal identifiable information maintained by healthcare and healthcare insurance industries should be protected from fraud and theft, and also addresses a limitation on healthcare insurance coverage. HIPAA has three main rules or components. The privacy rule, which stipulates how an individual's protected health information may be used. The security rule, which identifies how protected health information must be secured. And the breach notification rules, which must be followed if protected health information is compromised in some way. This lesson will focus on the privacy and security rules. The breach notification rules are beyond the scope of practice for field providers. HIPAA was originally passed and signed into law in August 1996. The privacy rule was implemented in 2003 and the security rule in 2004. Since its creation, HIPAA has undergone several changes. It is important to remember that HIPAA is considered a minimum set of rules to be followed for privacy or security. State or other federal rules may supersede HIPAA if they represent stronger protections for patient information. As an employee of a medical transport company, you are considered a healthcare provider and must comply with HIPAA rules. As a healthcare provider, it is your responsibility to secure a patient or client's protected health information. Under HIPAA, the organization, in this case Keystone Quality Transport, is required to establish rules and policies to preserve the patient privacy and provide for patients' rights, including limits on how protected health information can be used or disclosed without patient authorization. Protected health information, or PHI, under HIPAA is any information about health status, provision of healthcare, or payment for healthcare that is created or collected by a covered entity and can be linked to a specific individual. Protected health information can take many forms. Formats and media include verbal communication, written communication, and electronic records. An individual's protected health information cannot be used or disclosed unless specifically permitted under HIPAA. HIPAA permits disclosure of protected health information in three broad categories: treatment, payment, and operations. Treatment is the provision, coordination, or management of healthcare and related services for an individual by one or more healthcare providers, including consultation between providers regarding a patient and referral of a patient by one provider to another. Payment encompasses activities of a health plan to obtain premiums, determine or fulfill responsibilities for coverage and provision of benefits, and furnish or obtain reimbursement for health care delivered to an individual, and activities of a healthcare provider to obtain payment or be reimbursed for the provision of health care to an individual. Healthcare operations are any of the following activities: quality assessment and improvement activities, including case management and care coordination; competency assurance activities, including provider or health plan performance evaluation, credentialing, and accreditation; conducting or arranging for medical reviews, audits, or legal services, including fraud and abuse detection and compliance programs; specific insurance functions such as underwriting, risk rating, and reinsuring risk; business planning, development, management, and administration; and business management and general administrative activities of the entity, including, but not limited to, de-identifying protected health information, creating limited data set, and certain fundraising for health benefits of the covered entity. You should only disclose the minimum amount of information necessary to achieve the required result of releasing protected health information. In the example of transfer and care, it is not necessary for the next caregiver to receive information about the client's Social Security number. In the example of registering a client at a facility, it would not be necessary to disclose the client's entire past medical history. Patients and clients have specific rights under HIPAA. They include the right to access and view their own protected health information. They may ask for corrections if the information is wrong. They are allowed to access the information in an electronic format. They may request that protected health information not be used for billing purposes, but only if the bill is paid in full. And they are entitled to a full accounting of any and all disclosures of their protected health information. The HIPAA security rule went into effect in 2004, creating rules for the use and storage of electronic protected health information. HIPAA is enforced by the Office of Civil Rights at the United States Department of Health and Human Services. In December 2019, the Office of Civil Rights fined the West Georgia Ambulance Service $65,000 for violations of HIPAA security rules. This was the first time an EMS agency had been fined since the inception of HIPAA. The Office of Civil Rights may issue corrective action plans or fines against an organization that commits HIPAA violations. Violations may also be referred to the U.S. Department of Justice for criminal investigation that could result in additional fines, penalties, and jail time. The HIPAA compliance officer for Keystone Quality Transport is Mike Moretti, Director of Clinical Operations. Let's take a look at some specific HIPAA concerns that are present in the ambulance and medical transport industry. First, always remember that HIPAA should never delay or interrupt patient care. In the case of a true life-threatening event, the top priority is always the patient. Although not a normal practice for us here at Keystone Quality Transport, under the HIPAA rules, it is permissible to transport 2 patients at the same time in one ambulance. Remember that HIPAA only applies to covered entities. Most public safety access points and 911 centers are not considered covered entities under the HIPAA rules. Once again, remember that HIPAA only applies to covered entities. Law enforcement agencies are not covered entities under HIPAA. The potential concern for HIPAA violations comes from those times that you may provide information about a patient to law enforcement personnel. However, there are 6 exceptions to the HIPAA consent rules when interacting with police agencies. You do not need a patient's consent to disclose information in the following situations. When required by law, remember that as a medical transport provider, you are a mandatory reporter by law and must report cases of child abuse or suspected child abuse. If identifying information is needed to locate someone who is a suspect of a crime, a fugitive from justice, a material witness to a crime, or a missing person in general. If you believe the patient is a victim of a crime, when reporting a crime that occurs on company property, including inside the transport vehicle. And finally, when reporting an active crime, one that is occurring at the present moment. Dealing with the media and news agencies. Under no circumstances are field staff allowed to discuss the care or transportation of a patient client with the media or news agencies. All media inquiries should be directed to the HIPAA compliance officer. Smile, you're on camera. The public has a right to photograph or film anything they wish that occurs in the public setting. You have no legal authority to stop someone from photographing or filming you while performing your duties in public. Also, HIPAA applies to covered entities only. The public at large is not controlled by HIPAA. Keystone Quality Transport loves social media. We use social media as a communication tool with our staff and to promote the company. Be sure to like, follow, and share. Social media can be a great tool for a company like Keystone Quality Transport. However, it could also be a source of HIPAA violation. The simple rule: do not post any protected health information. Do not disclose protected health information in blogs, websites, discussion groups, on social media networks, or any other online public forum. In addition to HIPAA concerns regarding social media, also be aware that any social media post that portrays the company, management, other employees, partner facilities, even if the post does not involve protected health information, may be grounds for termination. Think before you post. It is permissible under the HIPAA privacy rules to disclose pertinent protected health information with relatives and even close friends if it would be in the best interest of the patient. As medical transport providers, you are part of the patient's healthcare team, and therefore you are required to be given a report of the patient's condition prior to accepting care. EMS ambulance users will be trained to use our electronic patient care reporting system during in-person training. You will be assigned a unique ID and password for the ePCR system. It is your responsibility to safeguard your user ID and password. Thank you for taking the time to view this presentation on HIPAA, Privacy and Security Training. If you have any questions about the content of this presentation, please contact a member of the training and certification team or the Clinical Operations Team. Please complete the HIPAA quiz on Google Classroom.